Are you ready to do some tracings? Before we get started, you should have memorized the major blood vessels that are on the wall chart in the audio tutorial lab. Make sure you know all those major vessels, and that will make tracing much easier. Now, if you think you're going to memorize all of these tracings, that's the wrong way to go about it. What you need to do is understand the pathway, and then it makes it easier. Many of them are alternate versions of the same pathway. So let's get started. You know, anytime we go to a tissue, it's at a capillary bed. In order to get into a capillary bed, we have to go through a small vessel called an arterial, and then you go into the capillaries, and then you exit that tissue by small veins called venules before you go back into the vein. So we represent tissue by ACV. That's little ACV. All lowercase letters because they're small. ACV. Now if you're already in a organ, then you start at the capillary bed of that organ and leave through a venule. So that would be CV. If you're arriving at an organ, you would start at an arterial and you would go into the capillary bed. So that would be AC. So it depends on whether you're going through an organ or whether you're starting in an organ or whether you're going to an organ as to what actually you will talk about in the tracing. So let's start with the first tracing. This one is kidney to kidney via the left myocardium. Of course, if I had it just kidney to kidney, it would be a pretty easy tracing. But what I want you to do in this tracing is understand how the left myocardium, that is the muscle of the heart, actually gets its oxygen supply or its blood supply. So notice that we're starting in the kidney. We're already in the kidney, so we're in a capillary bed. That would be CV, so capillary bed to a venule, and that would be CV. And then we exit the kidney through the renal vein. That goes into the inferior vena cava. You then enter the heart. You remember where you enter the heart at? Yep, the right atrium. And you go through the heart tracing. Now this is where you would stop and ask the instructor if they want you to trace the heart. We may say yes, we may say no. You may have already done it already by looking at the models or in some other fashion, and we might have you just skip that part. On the other hand, we could have you do the heart tracing as a part of every tracing that has the heart in it. You then leave the heart through the ascending aorta, the left coronary artery, and then you go to the circumflex artery. Now, if you want to know how you get into the left coronary artery or into the left circumflex or just the circumflex artery, because there isn't a right one, you could look in your textbook on page 661 and find out where those arteries come off of the ascending aorta and onto the heart, onto the left side of the heart. Now you're in the left myocardium, and you're going to go through that myocardium, so you're going to go through an arterial, a capillary, and venules, an ACV, all lowercase letter. How do you exit the myocardium? Well, you go to the great cardiac vein, and then that goes into the coronary sinus, which actually goes back into the heart again. So this one would have two heart tracings because we want to go back to the kidney. And of course, we're not going to ask both of those heart tracings, or will we? Yeah, we could. So you go through the ascending aorta, the aortic arch, the descending aorta, the renal artery, and then to the kidney. And that's tracing number one. Tracing number two is an interesting and an important one. Let's start at an IV injection, an intravenous injection. That's going to be on the left side. Not always does it have to be on the left side, but we're going to start on the left side. So we're going to go from the left IV injection at the cubital fossa. Remember what the cubital fossa was? Yeah, that dent in the front of your arm. So we want to then end up and see how that injection, whatever we might be injecting there, would get into the brain at a part that we call the right cerebral circle, which is in the middle of the brain. So in this one, the injection would go into the left median cubital vein. From there it goes to the left basilic vein. you might think that it would go into the radial vein, but this is a superficial injection, and the basilic vein is more superficial. So you go into the left basilic vein, into the left axillary vein in the armpit region, into the left subclavian vein, so we're going back up, the left brachiocephalic vein, and then into the superior vena cava. This is where we enter the heart. We have the heart tracing, and then exiting the heart we have the ascending aorta, the aortic arch, the brachiocephalic artery, the right subclavian artery, and here is where we go into the right vertebral artery. This artery is not pictured on very many of the diagrams, but you can find it. There's at least one good diagram that shows where the right vertebral artery will come off of the diagram off of the subclavian. The vertebral artery goes through the transverse foramen of the cervical vertebra. Remember those holes in the vertebra of the cervical vertebra? That's where the vertebral artery goes. And then you go to the right posterior cerebral artery and into the right posterior communicating artery, which is part of the cerebral circle. And that's tracing number 2. In tracing number 3, let's start at the spleen and then end up back in the spleen. So since we're already in the spleen, we would leave it from the capillary beds through the venules. So that would be thus little CV. We go into the splenic vein, the hepatic portal vein, and that leads to the liver, which is venules, capillaries, and venules. Because you're already in a vein, you don't go through an arterial capillary venule. You actually go through a venule. You leave a small vein and go into a venule, and then to the capillary bed of the liver, and then you exit through another venule. So that one's VCV instead of ACV. If you don't understand this, get some help from an instructor. You leave the liver through the hepatic vein. That goes into the inferior vena cava, where you then would enter the heart tracing. You go through the ascending aorta, the aortic arch, the descending aorta, and then, let's see, how do you get to the spleen? Oh yeah, that's right. You have to go through that small branch called the celiac trunk. Celiac trunk is also known as the celiac artery. The celiac artery leads in a number of directions, 3 main places, and one of those places that it leads to is to the spleen. So you would go into the splenic artery, and then you would enter the spleen, and you would go through an arterial and then into a capillary bed to get into the spleen. And that's tracing number 3. In tracing number 4, we're going to start at the renal artery, go through the kidney, and end up back in the hepatic portal vein. So let's start at the renal artery. We're going to go into the kidney, arterioles, capillaries, and venules, ACV. We exit the kidney in the renal vein. We go to which goes to the inferior vena cava, which goes to the heart. We do the heart tracing, and then we go into the ascending aorta and the aortic arch. Let's see, where are we going? Oh yeah, we're going to the hepatic portal vein. Let's see, how do we get there? Well, let's go through the descending aorta, to the celiac trunk again, and down into the splenic artery, going to the spleen. So you can see how this one is a version of number 3. We go through the arterioles and capillaries and venules of the spleen. We then leave the splenic vein and we go to the hepatic portal vein. There are several other routes that you could go. You could go to the stomach, or you could go to the intestines. You could choose. This one's one of the easier ones. And that's tracing number 4. Okay, in tracing number 5, we're going to start in the spleen again, but we're going to go all the way down to the right anterior tibial artery, down in the tibia area of the lower leg. So we start at the spleen. We are in a capillary bed there. We leave the spleen through venules, so that's CV. We go into the splenic vein, which leads to the hepatic portal vein, and that goes to the liver via venules, capillaries, and venules, VCV. And then we leave the liver through the hepatic vein. We go to the inferior vena cava, and that leads to the heart. We do the heart tracing, and then we leave the heart through the ascending aorta, the aortic arch, the descending aorta, and then we're going all the way down to the legs. So we go into the right common iliac artery, the right external iliac artery, the right femoral artery, the right popliteal artery, and that ends up can branch into the right anterior tibial artery, and that's tracing number 5. In tracing number 6, we're going to start in the brain, and then we're going to end up in the right spermatic artery, that is in the gonad of the male. So let's start in the right superior sagittal sinus. So look on page 692 of your textbook, and you can find out where those vessels are. That leads to the right transverse sinus. These are all veins, by the way, so they're going to be traveling back towards the heart. And that branches into the right sigmoid sinus, which goes to the right internal jugular vein. That leads to the right subclavian vein, to the right brachiocephalic vein, and then the superior vena cava. That enters the heart, and we go through the heart tracing, and we go through the ascending, we leave the heart through the ascending aorta, we go through the aortic arch, the descending aorta, and the right gonadal artery, or spermatic artery, or also known as the testicular artery, branches off of the descending aorta. So if we were going to go to the gonad of the female, that is to the ovary, we would do the same tracing, and it would be the right gonadal artery of the female or the right ovarian artery of the female. And that's tracing number 6. In tracing number 7, we're going to start in the last segment of the colon, that is the sigmoid colon. It's located on the left and center part of the lower body. And we're going to go to the right radial artery, that is to the right arm. So we're going to start in the sigmoid colon, capillaries and venules, and we're going to leave that through the left colic vein to the inferior mesenteric vein, and then that joins with the splenic vein before going into the hepatic portal vein. You go through the liver, and that's going to be venules, capillaries, venules, VCV, to the hepatic vein, and that enters the inferior vena cava, which goes back to the heart. We do the heart tracing. We leave the heart through the ascending aorta, go through the aortic arch, the brachiocephalic artery, the right subclavian artery, the right axillary artery, the right brachial artery, and then we end up in the right radial artery. And that's tracing number 7. In tracing number 8, we're going to start in the left arm and go to the right side of the heart. But we're going to go there via the diaphragm. So we're going to start in the left brachial vein, which leads to the left axillary vein coming up the arm, to the left subclavian vein, to the left brachiocephalic vein, which enters the superior vena cava, goes through the heart, leaves through the ascending aorta, the aortic arch, the descending aorta, and then off of that is the right phrenic artery. It's just above the celiac trunk and is hard to find on most diagrams. So the right phrenic artery goes to the diaphragm, arterioles, capillaries, and venules, ACV, to the right phrenic vein. That's how it leaves the diaphragm, to the right phrenic vein, and then goes to the inferior vena cava, which goes back up to the right atrium. And that's tracing number 8. So let's do tracing number 9. Number 9, number 9, number 9. We're going to start at the left internal iliac artery down in the lower part of the body, and we're going to end up in the right femoral artery in the right leg. So we're going to start at the left internal iliac artery, which branches into the left inferior gluteal artery, and that goes to the gluteal muscles. Yeah, that's muscles of your butt, right? And we go into arterioles, capillaries, and venules, ACV, and we then leave that gluteal muscle through the left inferior gluteal vein, to the left internal iliac vein, to the left common iliac vein, and that enters the inferior vena cava, which goes to the heart, leaving the heart through the ascending aorta, the aortic arch, goes to the descending aorta, going to all the way down to the right common iliac artery, to the right external iliac artery, and finally into the right femoral artery. And that's tracing number 9. Number 9, number 9, number 9. In tracing number 10, we're going to start in the tibia, down on the lower leg, and we're going to end up in the right frontalis muscle. That is a muscle on the front side of the skull, on the frontal muscle. So let's start in the posterior tibial vein, go to the popliteal vein, which leads to the femoral vein, which goes to the external iliac vein, to the common iliac vein, and then that leads into the inferior vena cava, which goes back to the heart tracing, exit the heart through the ascending aorta, go through the aortic arch. Let's see, where we're going. Oh yeah, we're going up to the head, the frontalis muscle. So we need to go to the brachiocephalic artery, the right common carotid artery, the right external carotid artery, the right superficial temporal artery, and that leads to the frontalis muscle. We enter the muscle by going through an arterial and into the capillary bed, an AC. And that's tracing number 10. Okay, here's the last tracing of the systemic system before we go into the fetal and the lymph system. This is tracing number 11. We're going to start in the celiac trunk, also known as the celiac artery, and we're going to go to the kidney. But we want to go there via the pancreas. So let's see how blood gets to the pancreas. So start at the celiac trunk, go through the hepatic artery, and we need to branch into the gastroduodenal artery. Gastroduodenal artery. The duodenum is part of the small intestine. That leads to the anterior superior pancreatico-duodenal artery. How do you say that again? Pancreatico-duodenal artery. And that leads directly to the pancreas. You enter the pancreas or go through the pancreas through arterioles, capillaries, and venules, thus the ACV. And you exit the pancreas in the anterior or through the anterior superior pancreatico-duodenal vein, and that leads to the superior mesenteric vein, which, as you know, goes to the hepatic portal system. So the hepatic portal vein, which leads to the liver, venules, capillaries, and venules. You exit the liver through the hepatic vein, go into the inferior vena cava, go through the heart, and out the ascending aorta, aortic arch, the descending aorta, and then you want to branch to the renal artery and back to the kidney, arterial and capillaries of the kidney. And that's tracing number 11, the last of these systemic tracings. Okay, let's do tracing number 12, which is one of the lymphatic tracings. Now, something you need to know about the lymph system. The lymph system is not symmetrical. The drainage of the lymph is not symmetrical in the body. So if you take the right thorax, the right arm, and the right side of the head and neck, that goes into one drainage, and all the rest of the body goes into a separate drainage. So both legs, the left side of the thorax, and the left side of the face and head and neck go into a separate drainage. All of the right side components, they go into a lymphatic duct that enters the bloodstream at the right subclavian vein. All of the left side of the lymphatic system, it goes into the thoracic duct before it goes into the left subclavian vein. So, in this one, we're going to start at the spleen, and we're going to go from the lymph system of the spleen, not the blood, and we're going to go to the liver, and we're going to go to the blood system of the liver. So we're going to start at a lymphatic vessel that's found in the spleen, and that branches into the left lumbar lymphatic trunk and enters a large sac of lymphatic tissue or lymphatic fluid, and that sac is called the cisterna chyli, sometimes called the cisterna chili, and sometimes called the cisterna chyli. You can say it however you want. The cisterna chyli is one way that I will say it. So that enters then into the thoracic duct, and as I said a moment ago, the thoracic duct goes into the left subclavian vein, which goes into, now we're in the bloodstream, right? So now it's just a blood tracing. The left brachiocephalic vein to the superior vena cava, through the heart tracing, out the ascending aorta, to the aortic arch, to the descending aorta, to the celiac trunk or celiac artery, which, remember, you can branch directly into the hepatic artery and go to the liver, arterioles and capillaries of the liver. And that's tracing number 12. Tracing 13 is another lymphatic tracing. And this one's going to go from the intestinal lymph nodes. And since it's in the intestines, all of that is going to drain to the left side, going through the thoracic duct. So it's going to go to the left subclavian vein. So we start at the intestinal lymphatic vessel, or lymph vessel, go to the intestinal trunk, to the cisterna chyli again, and once there, we go through the thoracic duct, and then we enter the bloodstream through the left subclavian vein. That leads to the left brachiocephalic vein, goes through the superior vena cava, and goes through the heart, and then out of the heart through the ascending aorta, the aortic arch, the descending aorta, through the celiac trunk or artery, to the splenic artery, to the spleen, arterioles, capillaries, and venules, and then we exit through the splenic vein, and that is tracing number 13. Tracing number 14 also starts in the lymphatic system and ends up in the blood of the spleen. We're going to start here at the left tonsil, which goes to the left cervical lymph node, the left lymphatic duct, which then goes into the thoracic duct before entering the bloodstream through the left subclavian vein, the left brachiocephalic vein to the superior vena cava, and now we do the heart tracing. Leaving the heart through the ascending aorta, the aortic arch, the descending aorta, the celiac trunk or artery, the splenic artery, and then into the spleen, arterioles and capillaries of the spleen. And that's tracing number 14. In tracing number 15, we're going to do one of the two fetal circulation tracings. We're going to start in the descending aorta of mom and go to the aortic valve in the fetus that she's carrying. So we start at the descending aorta of mom, go through the common iliac artery, the internal iliac artery, and then to the uterine artery. You could do either left or right on any of those. They all end up at the uterus. At the uterus, there's an exchange of nutrients across the placenta, but the blood does not exchange between the fetus and mom. At the placenta, which is capillaries, venules, and of the placenta in the fetus, you then enter or exit the placenta through the umbilical vein. You take the shortcut through the ductus venosus around the liver and into the inferior vena cava, to the right atrium, to the foraminal valve, to the left atrium, to the bicuspid valve, also known as the left atrioventricular valve, to the left ventricle, and then to the aortic semilunar valve. In tracing number 16, we're going to stay entirely within the fetus and do the circulation from the fetus's placenta back to its placenta again. But I have chosen the route. In this tracing, you have to go through the fetal right ventricle. So we start in the placenta of the fetus at capillaries and venules there. We then go into the umbilical vein, which goes through the ductus venosus that bypasses the liver, through the inferior vena cava to the right atrium of the fetus. So we're in the right atrium of the fetus. Which way will we go? Remember that in the fetus you could go two ways because of the foraminal valve, but in this tracing you are required to go through the right ventricle. So now you're going to have to go down to the AV valve instead of going to the foramen ovale. We go then into the right AV valve, which is also known as the tricuspid valve, through the right ventricle, and we want to then go into the pulmonary semilunar valve, the pulmonary trunk, but here we take the shortcut of going through the ductus arteriosus from the pulmonary trunk directly into the aortic arch. We're now in the aorta, so we go down the descending aorta to the common iliac artery, to the internal iliac artery, to the umbilical artery, and that leads back to the placenta. We enter the placenta through arterioles and end up in the capillaries of the placenta. And that's tracing number 16. And finally, here we are at the last tracing, the right axillary lymph nodes to the stomach. So we're going to end on a lymph tracing again, or at least we're going to start in the lymph and end up in the bloodstream. So we want to go from the right axillary lymph nodes to the blood of the stomach. So we start in the right axillary lymph nodes, the right axillary lymph vessel, to the right subclavian lymph vessel, and that goes to the right lymphatic duct. The right lymphatic duct dumps directly into the right subclavian vein. So now we are back in the bloodstream again, and the rest of this is just a blood tracing. The right brachiocephalic vein to the superior vena cava, through the heart, the ascending aorta, the aortic arch, the descending aorta, to the celiac trunk, also known as the celiac artery, to the left gastric artery, and we end up in the stomach, in arterioles, and then the capillary bed of the stomach. And that's the last tracing, tracing number 17. Now you just have to get these all together and get ready for the next lab exam.